East Coast Breakfast.
Highway to Health is brought to you by the KwaZulu-Natal Department of Health. Growing KwaZulu-Natal together. Dr. Sandile Shabalala, head of KwaZulu-Natal Department of Health, joins us this morning. Sawubona, Dokotela.
I'm not happy with you guys.
How? On what basis?
How can you be asking Sky about aircon?
Yeah.
Aircon and Sky don't mix.
How did you know that, Doc?
He doesn't know that thing. He knows a fan. That's how much he knows. Anything beyond that, Sky does not know.
Dokotela,
You are right.
he's a family man. He's not allowed to take his fans home.
Good morning. Good morning to the East Coast listeners.
Dokotela, so we are celebrating Human Rights Day. I'm trying to find the link between the KZN Department of Health and Human Rights. I'm sure there is one.
There is definitely a lot of links. Firstly, remember the Constitution has Section 27 and Section 28 in the Bill of Rights. Those two sections are specific to tell people that and children that they've got the right to health. That's the first part. Secondly, there is the Matupili principles. We have to follow that as health. Thirdly, there are charters, children's charter, older citizens charters. All these are patient charters that tell us how to treat people. So we definitely do link.
And Dokotela, in terms of your department, you do a lot with people in terms of the practices and the procedures you guys do have in place. Tell us how you make sure that human rights are always upheld.
From the very beginning, when you are consulting with any healthcare worker, one, you have to be respected. Whether what we say, even in our, if you now take it to the province, we have it even in our core values. You have to be respected. Even if you are the worst patient, you still need to be respected. But also you have to be involved in decision making. That is why before we operate on you, we say you need to consent to that operation. And in that fashion, we want to walk with you to where you want to choose whether you're operated or you're not operated. So that is how much we want to involve with you. But if you are a person who is not in a position to make that choice, again, the law allows us to take those decisions to say, this person needs to be given this treatment. Without this treatment, the person can die. Therefore, let us take this decision.
No, I wondered about I would check myself into a hospital. Okay, so I'm going in for a gastroscopy, right? And I'm not. I went there. I said to them, I want this procedure, and then they still hand me a piece of paper like, "Do you consent?" I'm like, "I came here.
No, you have to.
I'll put my
sign the papers.
No, you must sign the consent.
Doc is right. Yeah.
Okay.
Yes.
So, Doc, tell us, what avenues are there for recourse? So if you feel or you want to submit a concern to the department, how do you do that?
The first one in KZN. If you're in a clinic or any of our facilities, there are numbers that you can use. The PRO, the CAO, the operations manager's number, the district manager's number is there. The departmental persons that are there in head office, you can complain. Our WhatsApp line, our YouTube line, our Facebook line. So all these you can use. The worst case is when people go direct to the ombuds at the national level. You can also go to the presidency.
East Coast Breakfast.